Hi everybody, we are back. I am back. Okay guys, today I'm going to give you, actually I brought you a very interesting topic. This is just to encourage you guys to attend your antenatal care as soon as you know that you're pregnant. As soon as you miss that one period, please buy a pregnancy test and check. Because now we start getting problems which affect the babies you are looking forward to see being healthy and going home after birth, because of the change of the reluctancy, or rather the behavior we display in the very first trimester, or rather first 2 trimesters. So I'm bringing the topic of teratogenics. What are teratogens? According to JBF Cilias, teratogen is any agent that adversely affects the fetus, causing permanent damage on the anatomical, physiological, and the behavioral function of the baby. So these can be chemical, can be hormones and medication. He classifies them into 3 main categories, that is medication, chemicals, and radiology. Then in the medication, I'm not going to dwell much on the first one. He mentions 4 main ones. I'm not going to dwell more on the first one because it has been phased out. That is the thalidomide, which was causing limb problems like amelia and the phocomelia, whereby the baby is born with the missing limb, whether it's upper limb or both upper limbs or both lower limbs or one limb. You remember those babies who had those problems, they have a stumpy there. It was because of that, and then when they realized that it causes such problems, and then they removed it. But now we still have the 3 that we are using. I'm talking about our warfarin, which we use to treat our coagulopathy problems like the PE and so forth. PE, that is your pulmonary embolism, and other coagulative problems. So your warfarin, if you are pregnant, it causes central nervous system deformities, or rather defects on the baby, and also embryopathies. It also causes the stillbirth and the hemorrhages. Was you find that you develop your placenta abruptio, you don't know where it's coming from, forgetting that you are on warfarin, of which when we know that you're pregnant, we change you into a drug that is having a bigger molecular mass that is not going to cross the placenta, referring to your heparin. So it's important to report that you are pregnant so that you get your baby protected against such. Another drug that we use commonly is our first drug treatment of hypertension, which are your ACE inhibitors, that is your enalapril. It is causing a serious problem of intrauterine fetal death and your fetal renal failure. So it's important to report, because if we know you are pregnant, you get to be changed into things that are compatible with pregnancy, like your methyl dopa, which is also known as your aldomet. You're going to be on that until you deliver, then you can change you back to your enalaprils. And the other thing that you need to consider is those antibiotics that are used to treat infections. That is your tetracyclines specifically. Tetracyclines have a tendency of causing your fetal bone dysplasia and the discoloration of the teeth. And then we come to the next category, which are your chemicals. Chemicals, it's mainly the cigarette smoking. We beg you guys to try and modify your behavior when you are pregnant, because as much as it is not that easy, you must think for this baby you want to have and being healthy and not giving you problems after birth. It's only 40 weeks, just 40 weeks, and then you're fine. And you might not even finish the 40 weeks, you might deliver at 38 weeks, and then you're fine. You go back to your smoking habit, because the very same cigarette is going to cause the fetal restriction growth, the intrauterine restricted growth, making your baby small for the gestational age, and that has implications such as developing respiratory tract infections that are very, very bad. Sometimes they kill the babies. You get the baby getting a neonatal death from those respiratory problems, and sometimes they struggle to mature because of being very small. They are so prone to lots and lots of infection. You can even get a premature birth from poor perfusion, because the main cause of this poor growth of the baby during this smoking thing during pregnancy is due to poor placental perfusion that is caused by the constriction of the blood vessels in the placenta that is caused by the nicotine in your cigarette. So smoking is a serious problem, and it also causes other problems such as hypertension. If you're pregnant, you might develop gestational hypertension, especially if you have what you call a family history. If you're already hypertensive, it's going to make it difficult to control your hypertension. So it just brings more and more problems. And remember, hypertension is a boss of restricted intrauterine growth. So let's protect our babies. Let's fight for these good outcomes and increase our families with healthy babies. Another problem is the alcohol. Guys, alcohol baby syndrome has been the song that we don't want to sing as the people who take care of your pregnancies, because we want healthy babies. Alcohol during pregnancy is not good because it causes the mental retardation to the baby. You find that the baby is having intellectual development. The baby doesn't grow like the peers in terms of IQ. It's having a low IQ. It's due to that very same alcohol. Sometimes it even causes the facial dysmorphic features. You really don't want a baby who is going to be different from other people that are considered to be normal. And then things that you can prevent, let's try and avoid them. So if you know that you missed your period, you go and buy a pregnancy test, you confirm, you start your antenatal care, you modify your behavior, you stop alcohol until at least you deliver. And then the last thing that he emphasized on is your radiology. Radiology, if ever we don't know that you are pregnant, you're going to be sent, if you are sick, you're going to be sent for x-rays and other things that are going to expose your baby to radiology. And then you find the baby developing leukemia, which is the cancer of the white blood cells, which are necessary to form the immune system. You cannot do things without the immune cells like white blood cells. It affects the bone marrow, and then it struggles to produce enough white cells, or rather, let me say, it just disrupts the whole immune system because you wouldn't be having enough leukocytes. And then it also causes what you call hyperthermia that can cause craniofacial anomalies. We're talking about facial defects like cleft palate and cleft lip and cleft palate and other nasal bridge deformities. You don't want a baby who have such problems. You want healthy babies. So guys, please make sure I'm overemphasizing the issue of starting early, because people think the best way to know that you must start your antenatal, it's when you have a well-established pregnancy, you are 16 weeks or so. Oh, no, you'll be very late. Remember, the most important part of the baby is the phase where they start developing their organs. The rest of the period is just maturation of those organs, and that is the time, which is 3 to 8 weeks after conception. That is what we call embryological phase. During embryological phase, it's where all the essential organs are developing. So as to how much damage these things are going to affect your baby, it depends at the stage at which the organogenesis was happening, and then that's where it's going to affect your baby. So that's why I'm saying it's important. The best medicine is to prevent the whole thing altogether by making sure that as soon as you miss your period, you check, and then you find out if you're pregnant, you start your antenatal, you start modifying your behavior right away. I believe, guys, we live in the days of Google, where people Google more information. Please go and read more on this. I'm just conscientizing you, making sure that you pay attention on that. Conditions like diabetes mellitus and hypertension and all that. However, I'm going to focus on the diabetes as an example, which is causing a lot of problems if ever it is not monitored properly. And it can only be monitored properly if you attend your antenatal care as soon as you know that you're pregnant. So diabetes that is not controlled well, it's going to overwhelm the body and start causing like fetal stillbirth, cardiovascular problems. Sometimes not always, but sometimes it does cause the central nervous system problems like neural birth defects. So it's important to prevent such things. And if you are looking forward to have a normal vaginal birth delivery, you're going to have problems because such things, they cause what you call microsomia. As much as I don't monitor normal what you call patients with coexisting medical problems due to the fact that they fall under high risk, but you still get an opportunity to deliver normally to be delivered by the gynecologist or rather obstetrician if ever everything goes well. But if now you develop microsomia because your glucose is not well controlled, you're going to have problems with that, and then you will have to be taken to cesarean as a way to prevent complications. So if you know that you have such problems, you need to make sure that you attend as early as possible, because remember, the body adapts by adding more energy to the body to cater for the upgrowing fetus whenever you are pregnant. It's unlike before. So the medication you've been taking to control your glucose during the pre-pregnancy state, it's not going to be effective with the same very dose during pregnancy because of such problems. So it needs adjustments, because your carbohydrate production rate has increased as well to accommodate the baby that is growing. So those are some of the reasons. I know that we live in the days of Google, and Google is mixing opinion information and the research information. You won't be able to always filter that. Hence, we are here to give you the health education. So you are welcome to subscribe and follow us so you can listen and learn more and more information. Ask questions whenever you feel like. You can also post your questions on our social media platforms: Twitter, Happy Soul Mother 1, Instagram, Happy Soul Mother 1, and Facebook, Happy Soul Mother and Child. We are more than willing to help you. We are going to be using every platform to check all your questions so that we can answer you. There's also our WhatsApp line there. You can also post your questions there. We look forward to hear from you and tell us what you think about us. Please do rate us so that we can know if we're doing the good job or are not yet there, because my whole point is to make sure that I help people, inform them, protect their babies, and be able to get their healthy pregnancies. Thank you. Hope you enjoyed. Hi everybody, we are back. I am back. Okay guys, today I'm going to give you, actually I brought you a very interesting topic. This is just to encourage you guys to attend your antenatal care as soon as you know that you're pregnant. As soon as you miss that one period, please buy a pregnancy test and check. Because now we start getting problems which affect the babies you are looking forward to see being healthy and going home after birth, because of the change of the reluctancy, or rather the behavior we display in the very first trimester, or rather first 2 trimesters. So I'm bringing the topic of teratogens. What are teratogens? According to JBF Cilias, teratogen is any agent that adversely affects the fetus, causing permanent damage on the anatomical, physiological, and the behavioral function of the baby. So these can be chemical, can be hormones, and medication. He classifies them into 3 main categories, that is medication, chemicals, and radiology. Then in the medication, I'm not going to dwell much on the first one. He mentions